This video is called How to View Health. And the first, good metaphor is that basically it's like an obstacle course. If you do the things that are good, these are Super Mario Brothers, you get energy points. You feel better, you're healthier. If you do the things that are bad, stay up too late, get drunk, smoke cigarettes, you lose energy points. You age more rapidly. And so then the question becomes, well, what is good and what is bad? How does one know? And in a sense, the way it works kind of is that there are multiple things working against us. The system is not designed to make us healthy. Just from the get-go, the air is polluted. There's the trails of chem, you know what I'm talking about. The lights in the houses have been switched out for blue LEDs, which, our photoreceptors sense that as day. So we have abnormal circadian rhythms, many people, because they're exposed to blue LED lights in their homes, their computers, their cell phones at night too much, and they don't sleep as well as they should. So you want to try to get the blue LED lights minimized as much as possible in the evening. I got separate lectures on how to sleep better. Avoid the excessive stress, caffeine. Coffee's not good for you. Tea is not good for you. Okay, sleep deprivation is bad. Try to go to bed earlier. Atheism weakens people. It turns people into hedonistic, wimpy losers with no meaning or purpose. I've seen a lot of people become atheists and then commit suicide, become alcoholics, drug addicts, drop out of school. It ruins people. And then there's all these minor toxins we're exposed to that, by themselves we can overcome them with our immune systems, but in aggregate, they can make us pretty sick. The fluoride in toothpaste and mouthwash, the dental cleanings, it's all bad. You never want that. The mercury in amalgam fillings, the root canal toxins as the bacteria change from aerobic to anaerobic and release toxins into your blood. All root canals are infected. The composites, which pretend to be better, but they got aluminum oxide in them, which is another major neurotoxin. So what I'm getting at is this idea of no matter what you do, modern life is nickel and diming you to destroy your health. And, the microplastics, if you're drinking bottled water, it's good to have reverse osmosis water that you put into a glass container. The aluminum, fluoride in the water, the endocrine disrupting chemicals. So what I'm getting at is no matter what you do, there's a bunch of things working against you. That's why everything you can control, you should try to optimize it. The personal care products are full of estrogenics, aluminum in the deodorants. All of the non-organic food is garbage. All the processed food is garbage and bad for you. From atrazine to glyphosate to soy to hexane to BT corn, the fungicides put on there, the APL, MSG, aspartame. All the fried food is always bad for you. High fat, animal protein, it's all bad for you. You're getting EMFs, you're getting Wi-Fi. And be careful of the medical system. Many of the drugs, hundreds of them, are mitochondrial inhibitors. Things that smell bad are usually SERCA inhibitors. Be careful about any type of screening study. You'll get trapped for years with incidentalomas, which can be very, very expensive and painful and worrisome. Bogus medications that don't work. So anyways, how does one deal with that? And what I'm saying is just ask yourself, what do humans do? Be like Adam and Eve, keep your indoor heating and plumbing. We talked about the diet a million times, low-fat vegan, no oil, no tobacco, nothing, always whole foods, all these other things, sleep, religion, have a strong purpose, Christianity, all the major religions help people. Consider getting amalgams removed. Not everybody needs to do that, but a lot of people do. Okay, and basically be minimalist. Okay. And then one of the things I use as a metaphor is the idea like Indiana Jones in the Temple of Doom when he had the mind chase scene and now he's outside on the edge of the rock and he has only a tenuous foothold. And what's happening is he has to keep moving as the water is rushing out of the mine. This segment was flooded, or the foot place he's standing on is going to be rinsed away. So what am I talking about? I'm talking about getting old. As you get old, you get more fragile. And what you could do when you were 20 years old, 30 years old, 40 years old, the older you get, you can't do that anymore. I'm 62, so I can't stay out all night and drink or something. No way. I wouldn't be able to work the next day. So the older you get, the more careful you have to be, and the way you should keep on improving your health habits so you can maintain your health, because it's either use it or lose it. And you have to keep on learning, how can I improve my health? What more can I do? Like the average chump is always saying, oh, do I have to do that? Whereas the proper response is, what more could I do to be healthy, to protect myself from all these inevitable insults that come at my health? Okay, and then the social is real important. Try to get along with your friends, your family, your coworkers, because this painting, this beautiful painting called Filial Piety by Jean Gruz, 1763. So basically this old guy, he's a paraplegic. If it wasn't for his family, he'd be dead. All right, and of course, he served them, I'm sure, as best he could all of his life until he became a paraplegic. So you gotta, maintain your social relationships, and then also have a sense of, making the most of a difficult situation. So here's Dante. He was exiled from Florence. He's very sad about that. But instead of sitting around just being sad, he decided he would write one of the greatest poems and epics of all time, the Divine Comedy. Okay, and so everybody's had their own disappointments in being ostracized or exiled. Like, I'm kind of exiled from conventional medicine, which pisses me off, but I sort of feel like, well, I'm better, being exiled than what else they might do to me. So, and what Dante said as well, I can write a better book than any of you, and that's basically kind of like what I've done. I can make better health videos, write better than they can. Conventional medicine is a joke. Their textbooks, they all stink because they're just really designed to sell drugs, not to help patients. And I like Thomas Aquinas. It's always good to study history because you'll find role models. St. Thomas Aquinas, unifier of faith and reason. He baptized, Aristotle. I baptized Ayn Rand, all right? And I'm a big believer in the unification of faith and reason for healthcare. In my opinion, all of our institutions in America have gone down the tubes because they're no longer Christian. The reason the healthcare system has become a joke based on profit instead of based on helping people is because once you go into atheism, there's no longer any right or wrong. There is no moral foundation. So all the higher ups, they just sell out for money. Why waste your time with a low-fat vegan diet when you can put a stent in somebody for $30,000? You can do an open heart surgery and end up getting $200,000 paid. Why would you teach low-fat vegan and make nothing or just a few $1,000s? So what I'm saying is, the modern scientific method comes from the Catholic Church. Almost everything great, most of the great achievements of mankind come from the Christian Church. It's just a fact. You can study it for yourself. And so I'll be part of that tradition, do the best I can to keep the truth alive for health, for nutrition, for academics, for civilization. So anyways, those are some thoughts. Hopefully they're helpful.